Well, about 1 in 6 Americans have some form of arthritis. Although you might think it affects mostly older folks, more than half of those with arthritis are under the age of 65. Joining us now, Dr. Assil, a board-certified rheumatologist and internal medicine specialist at Foxhall Internists. Doctor, thanks for being with us this morning.
Great to be with you.
You know, it's fascinating. We hear people talk about arthritis all the time. I did not realize how many people have it, nearly 50 million Americans.
That's absolutely right. It's actually one of the most prevalent chronic conditions in the United States, and like you said, 50 million Americans suffer with it.
What is it?
Arthritis is a lump basket term for a number of conditions. In fact, it describes more than 100 disorders or diseases. Of course, the most common is osteoarthritis, or the mechanical wear and tear arthritis that most of those 50 million people suffer with. But there's another category of, let's say, autoimmune inflammatory arthritis, like rheumatoid arthritis, like arthritis that is associated with psoriasis. Gout is another one, although it's not considered autoimmune. Arthritis associated with Crohn's disease and inflammatory bowel disorders. So there are many other types of arthritis.
So the big question is there anything preventative that we can do to try to avoid it if it seems that so many people are affected by it at some point?
Yes, of course. Of course, if it's along the realm of autoimmune arthritis, that's more your genetics and your predisposition and so on. So we don't have as much control over that. But for the osteoarthritis category, of course we can. First and foremost, weight. Obesity is the single most important risk factor in not only the development of osteoarthritis, but progression of the disease. So if we can intervene at the level of, let's say, childhood obesity, if we can intervene so early on in order to not allow this disease to become so prevalent. Stay active, be involved in sports, strengthen your muscles, resistance exercises. Osteoarthritis, again, of the knee, one of the most important ways to prevent it and also to prevent progression of it is to strengthen your muscles, the quadriceps muscles. So all the common things that we think of to be healthy are very helpful.
Is there help for it once it starts? If we start to notice the symptoms that we might be getting something, is it too late at that point, or can we control it?
It's never too late. You're absolutely right. It's never too late. In order for us to control osteoarthritis, which is unfortunately an uncurable disease, if uncontrolled, eventually people will require surgery and joint replacement. In order for us to halt down the progression of the disease, the most important thing that people can do are weight loss. If you think about it, every single pound of extra weight can put the equivalent of 4 pounds of extra pressure on the knee. So weight loss is the most important thing. And then continue to be active and exercising and moving around.
And the last thing that I'll ask you is what we started out with, which is the fact, the age factor. A lot of people think that arthritis only affects old people.
Yeah.
And by old here, I'm not meaning old, but those over the age of 65.
Sure.
That's not true, right? It affects all ages?
Absolutely. In fact, 2/3 of people with arthritis are younger than the age of 65. Wear and tear or osteoarthritis can develop from ages of 50 and 55 and above. But autoimmune arthritis, let's say rheumatoid or arthritis from lupus, develops at a much younger age. In fact, most of these are women in their 30s and 40s. So it can affect any age group, in fact, even children. Juvenile rheumatoid or juvenile idiopathic arthritis affects children or babies even.
Something to watch our entire lives then.
Absolutely.
Doctor, thank you so much for being here. We appreciate all your insight and your help this morning. Allison, by the way, this is May, which is Arthritis Awareness Month.